The Royal Preston Hospital, under pressure again from COVID. In the last 3 days, the number of patients here with the virus has almost doubled to 60, and despite the vaccine, no one here is safe.
How are you doing?
Not so bad now.
You all right?
Yeah.
Susan has a lung condition and shielded for 12 months. She's fully vaccinated, but got so ill, thought she would die.
For my children, well, I sent them all a message at 4:30 in the morning, telling them that we had to say goodbye because I was going to be put into an induced coma and ventilated, and my odds wouldn't have been good.
That must have been horrific.
Yes,
Really.
it's the hardest thing I've ever had to do in my life.
Her consultants convinced the vaccine saved her, and the ward is full of similar stories. What the next few weeks will bring is on everyone's mind.
There seems to be a popular misconception that COVID has somehow disappeared. We're working in the midst of a hospital like this with COVID patients. It is crystal clear to me, and is a cause for enormous concern, that COVID is very much around. And in fact, if anything, the numbers of COVID patients coming into hospital is going up.
Half this ward is taken up with COVID patients now, and the vast majority who become critically ill are unvaccinated. If it is complacency driving up cases, then staff here are desperate to get the message to people out there: do more to protect yourselves. That same message came from the government today, along with a warning cases could hit 100,000 a day.
We need to get even more people protected. We've got the jabs. We just need the arms to put them in. Not just to save lives, but to keep your freedoms too.
This is why we're being told to get vaccinated. There were nearly 50,000 cases recorded today, up 17% in a week. Hospital admissions are also up 11%, and there were 179 deaths, up 21%. The time for restrictions, some say, is now.
Let's recognise what's likely to happen. Let's mobilise the government and the public to try to reduce the risk, reduce the spread, rather than stumbling into a crisis.
The government hopes booster jabs and 2 new antiviral drugs will avoid the need for more restrictions this winter, but it's a gamble few want to take. Emily Morgan, ITV News in Preston.